And so we have another panel coming up here, another interview really coming up with someone who did make some big press last week around the, women's health area, which HITLAB and the Women's Health Tech Initiative is known for around the world, really trying to reduce improve women's health through digital and reduce gender inequality. So first of all, I want to introduce Sheila Collins from AARP and Deborah Bass, the CEO, a global CMO and president of Nuvo. Thank you both for joining us, and Sheila, handing the virtual podium over to you.
All right. Thank you so much, Stan. Great to be here. Great to see you, Deborah. So AARP Innovation Lab, our focus is on supporting and discovering the most pressing startups that are helping to tackle society's issues as we age. We know that we go through many life milestones. And Deborah, I wanted to turn to you to hear about your work, your role, and what you're seeing as opportunities for tech empowerment during life's important milestones and stages.
Yes, and great to be here. So I'm Deborah Bass, and I am currently at Nuvo, but prior to Nuvo, I spent much of my career in consumer goods and now have sort of this expertise in consumer-driven healthcare. What's really interesting is seeing my former world of consumer goods and healthcare collide. Particularly, consumer goods used to be brick and mortar, and then it shifted to e-commerce, but really omnichannel. And that's really what we're seeing happen in healthcare. It started out brick and mortar. We've added on telehealth and remote patient monitoring. And now we're seeing this sort of hybrid care delivery. And in the space where I play in pregnancy care, it's really needed for a few reasons, right? One, we're seeing access constraints. 50% of US counties have no practicing OB. There's maternity deserts where we need tech to extend care. But the other exacerbating factor has been this pandemic, where we're seeing clinics close or tell pregnant women to stay home because they're a vulnerable population, yet they can't go unchecked. So having the right telehealth infrastructure and high fidelity remote patient monitoring tools are really important to empower pregnant patients, but also to ensure care continuity in something like pregnancy that can't be deferred.
That is so important, and that is so key. In my area, I'm seeing solutions that are also helping with supporting those who can't leave their house, who are part of a vulnerable population. One example of that is Timbo Health. They focus on providing specialty doctors for people who are in senior living facilities. And so we know that in those populations, there may be limited access to leave. And so this is bringing those specialists into the facility. When it comes to specialty care, what types of needs are you seeing for, as you mentioned, pregnant women?
Yeah, so on specialty care, I think there's two big trends we're seeing for pregnant women. And one, for those of you that aren't as close to this episode of care, I'm guessing many of you are as either parents or aunts and uncles, et cetera, most of maternal fetal health happens outside of the clinic. And really to ensure great maternal and fetal health outcomes, it's a full team sport. And we're seeing this trend around extended caregivers. And when we talk about extended caregivers and a lot of the problems with social determinants of health, et cetera, is you not only need the OB, but you also need social services and mental health experts and nutritionists and lactation consultants. So the other trend in tech is extending touch by bringing a broader array of specialists into the care equation. And we're seeing companies like Poppy Seed Health and Kayaba Care, other startups in our ecosystem, lean into that trend and that need for broader caregiving beyond the OB. Another lens I could talk about is deeper specialists. So if you think about pregnancy care, there's the OBGYN, but for high risk pregnancies, they're maternal fetal medicine specialists. that's also constrained in terms of capacity. So how can we use tech to extend reach and eyeballs of maternal fetal medicine specialists? And that's much of what Nuvo has built with its deeper fetal surveillance platform.
Nice. Deborah, when you talk about the caregiving aspect, that is so critical. 1 in 5 Americans are considered caregivers, and we know that caregivers are the backbones of the healthcare system. When it comes to that, you're on one spectrum, I'm on another spectrum, but it is life's continuum. One company that comes to mind that's doing really great work that helps all of the populations of caregivers is Ayana Care. They have a platform that supports individuals who are the caregivers in creating a team, as well as providing those caregivers with access to resources, financial planning, and things that they need to support the care recipient. So those are things that I look to for, especially during this time when getting that type of support may be limited. I wanted to also learn from you about just other things that you're seeing that's really focused on the empowerment aspect during this time period.
Right, so I'll talk about empowerment through both a provider lens and a patient lens. I'll start with provider. What we're seeing right now broadly amidst the great resignation is acute staffing shortages in care, right? There aren't enough nurses, there aren't enough techs, there aren't enough doctors. So what we've seen is remote monitoring platforms are empowering to providers to help them better manage their constrained capacity and really bring patients into the clinic or hospitals that need to be seen, and the opportunity to move more routine monitoring or care to the home, right? So it's empowering because I have more control over my schedule and my constrained resources. That's one thread. The other thread is for the patient. So we know millennial moms or pregnant patients live by their phone, right? Everything I do is enabled by my phone. And I want that same access to better manage my pregnancy health and outcomes and have an equal seat at the table with my OB care team. So we're seeing the opportunity to empower mom through more education, through more tools to have her best journey and her best outcomes. And that's so important.
That's great. Thank you, Deborah. And thank you, Sheila, for a wonderful interview and highlighting a really important issue again that came up several times, a lot of times last week at the JP Morgan Healthcare Conference, and going into some deep dive here. And again, Deborah, congratulations on the announcement last week of your big raise. We're really happy about that and always rooting for Nuvo Care. Thank you.